So hi everyone, we're back again with another webinar of ideas. This time we're going to follow with our English schedule, and today we have Professor Hytham Aziz from Egypt. He's right now assistant professor in Alexandria University, and he has been doing courses in Liverpool, United Kingdom, and Egypt, and he's amazing as in what he's doing, especially in the subject he's going to present to us today, which I'm really interested to hear. So I'm just gonna forward to him immediately because we're not gonna wait because we're already delayed into because of the connection problem, and I'm sorry about it for like 25 minutes. But now we're live and everything is fine. So we're gonna go to Hytham. Hytham, you can begin.
Hi, Shane. How are you?
Perfect. How are you?
I'm really happy today to be on the webinar, and I'm fine, thank you. We're having the fasting month here in Egypt, and everyone is excited about how the lack of food is getting them spiritually energized. So I wish you are also energized spiritually and ready for the subject of this webinar. So, to start, I would like to first introduce the subject in a set of brief questions, and I would like to introduce you to my little daughter here in the picture. I will tell you how she will help with the webinar.
I didn't know you had a daughter.
Yeah, this is Mariam in the picture. She's at home now. Not sleeping as in the picture you see, but I will tell you how this will help with the webinar. So first to start, I don't know if you have the same culture or not, but let me ask, and I wish if I can get some answers from you or through Cheyenne. Were you as children sometimes feeling pain, and then a mom or a grandmother came and then told you where is the place where it's painful and started to rub the place for you, and then tell you this will make it better, and started maybe singing a song or reading you something, and then with the pass of time the pain actually got better. Did this happen with any of you?
I don't know. The question was hard for me. I don't remember.
Any ideas? Maybe anyone on the webinar link? Anyone from the Facebook?
We can wait for the comments, or we can even do it at the end. I don't know.
Okay. I'll start asking a set of questions anyway. Another question: do you have a family member or a younger relative who you got to sleep by rocking on your lap, maybe, or by rocking on a rocking chair? Did this happen with any of you? That's the second question. Third question: did you at any time had a headache or pain or dizziness, and someone told you to close your eyes, relax for a couple of moments, think about something positive, or you saw a movie, or you were in a lecture and you were told to do that, and it actually felt a bit better, even if not drastically better, but a bit better? Well, the answer to those previous questions is usually yes, even if it's once in a lifetime or you saw it happening with someone else. And the reason why I'm asking you this is because usually people think of hypnosis as a very difficult and requiring a special training to do activity, when actually hypnosis is an act that we do normally in our daily lives, even if we are not specialists, and we have been taught to do this by our elder family members, sometimes friends, sometimes religious individuals of our communities. And why we are saying this is because hypnodontics, the subject we are discussing today in the webinar, is the blend of hypnosis into dentistry. And although this would link more with a more professional view of dental treatment under special hypnotic messages or hypnotic sessions, but actually even a regular dentist who has been practicing for a while practices some of hypnodontics with his daily practice. The way we receive the patient, the way we introduce the patient to the instruments sometimes, the way we discuss specific things with patients as explanation of the procedure that's going to happen, or as explanation of, or as an induction for an anesthetic that we're going to administer or inject. And sometimes even after the procedure, the way we assure the patient after something that they're expecting as a swelling or some mild discomfort or pain, the language we use when we become experienced is an example of hypnodontics. And to get a real view of what hypnodontics is, I thought of bringing you to some history of hypnosis used in medicine and dentistry. And whenever that comes into the literature, then we have to mention the well-known, actually there is no specific title for his job, but the well-known, I would say, psychotherapist, Franz Anton Mesmer, during the 18th century. Some people say he's from Vienna, some people say he's German, so it's debatable in the literature. Anyway, he's the first person who suggested the idea of introducing energy and the use of energy to sort of ease pain or get painful experiences to be milder, etc. And he called it a specific name, which was named after his family name, which is mesmerism. Mesmerism is described as moving the magnetic, negative, bad energy from the painful body part out to get that part to be pain-free and then become healthy again. This was first done by Franz Anton Mesmer during the 18th century and was mainly used to ease the induction into surgical procedures or to do specific trainings to make the pain less during labor, etc. But then Dr. Oded did extracted a couple of teeth, and that was the first use of hypnosis into dentistry on the 23rd of January 1833. And that was the first use of frank and direct hypnosis into dentistry, and actually a very brave and bold use, because he did a hypnotic session for a patient, female patient, after which that patient got 3 teeth extracted without anesthetic. This is cited in Hollander, 1932, in his famous article on hypnosis use in medicine. And it states that the patient even suffered less bleeding after the procedure and less post-operative pain after being brought back to wake up. And although the date sounds really historic, I mean, 1833, we must have gone way more advanced into this field. However, the reality tells a bit a different story. Now, what shall be covered today is a bit of history and what do we identify as hypnosis during our current times. Then the uses of hypnosis in dentistry in the literature, whether therapeutic or operative, and why did it disappear? Why did hypnosis become less of a gone-to area in medicine and dentistry? And then finally, how can we practice some hypnosis in our daily dentistry, or what can be an easy way to incorporate hypnodontics into our education and further use? Are you following, Cheyenne? Are you with me?
Yes.
Okay. Are we already live now on Facebook, I mean?
On Facebook, no, but on YouTube, yes.
Okay, very well. So now the reason why I brought Mariam into the equation, Mariam is my little kid here. I'm not sure if you can see the picture again. And I'm showing her because we, until this moment, me and her mom, still have a major problem of bringing Mariam to sleep at night. And the reason why we have that is because we've done a lot of reading as soon as she was born. We've done a lot of reading on how can we or should we do things right. So we adopt a very strict protocol with the type of food she has. We don't show her any screens. We try not to bring her around TVs or mobile phones. We try not to get her into a disturbing environment. And still, we could not find the clear and direct way to do this simple job of getting her to sleep. Now, I don't know if you guys know or have been through the experience. We are taught how to sleep gradually. So children actually don't know how to sleep. What they feel is they feel really tired at the end of the day. They feel exhausted. They start rubbing their eyes. They start feeling confused and dizzy, and this gets them to feel angry. This is the basic sequence of events for a child. So what happens is, after a while, they start crying. I guess they have a headache or they have pain in their head, and they want to sleep, but they don't know what will happen next. Now, the thing that I got to know from elders around us is that a good way to get a child to sleep is to use a rocking motion. Rocking motion is to bring the child on your lap and start moving her forth and back, or start rocking her on a chair, or even put her into your lap as a mom and start moving her side to side. And this usually works with children. It gets them to start feeling a bit dizzy, and then in a while they start closing their eyes. And I remember very well a relative of ours used to put her index or thumb finger in between her eyes at the forehead, and then start moving that finger downwards towards the nose. And it was really interesting to see that this actually helped Mariam to close her eyes. With the rocking, gradually she went into a sleep-like experience. With time, she got to sleep well, and with time she got to get used to this habit of how to get to sleep. And it was just a coincidence that I got to know that this actually is a way of inducing hypnosis. So an example of what we do on daily basis with children is a good example of hypnosis to induce them to sleep. Now, of course, hypnosis or the hypnotic state and sleeping are two different things. I will come to that in a moment, but it's a similar way of inducing both experiences, and at the same time it produces the relaxation desired, after which the child can actually go to sleep. Now, this is one example of what we identify as hypnosis. A second example is suggestion as a hypnotic modality of treatment. And we all do this on a daily basis when we talk with patients and give them treatment options. So, for example, when we discuss treatment options as an implant compared to a bridge in an extracted tooth, spot. And usually, as dentists, being more aware of the consequences, still we have to explain both alternatives. And what we do is we explain that the implant is the procedure of choice at the moment whenever the bone is fine, whenever the bone is healthy, and the systemic condition of the patient supports that. And it replaces the tooth with a single tooth with a crown, where the procedure is dependent on that specific place and not dependent on two neighboring teeth, which could be endangered by a bridge. And then we explain the bridge as an alternative. So we say we prepare both teeth in a specific way to be as conservative as possible, and then we rest two crowns on them, and then we have a pontic in the middle to replace the tooth that is missing. But at the end, we usually suggest that if the patient is systemically healthy, the implant is the more reasonable option because of the advancement with the how we place implants at the moment, and because of the outlook of us as conservative dentists to try to conserve as much tooth structure as possible. So we preserve or conserve both teeth on the sides, and only do the surgery at this specific missing tooth site. Now, what I have done now is to explain both alternatives, but indirectly suggest one of them, which is the implant as an alternative. Now, what I did is an example of hypnosis. Although this is not directly or clearly stated or called hypnosis, but still, when you take more time explaining a specific modality of treatment, when you use a specific voice intonation to explain that modality compared to the other one, and when you use a more convincing outlook to that modality, then you're suggesting that modality, and this is an example of hypnosis. Now, a third example of what we do or mimicking hypnosis is the way we have the culture of rubbing the place to ease the pain. Now, this is even done by experienced practitioners, and it has, of course, a scientific justification, which is when you rub a place, you sort of distract the patient from the pain in there, but still, it's an example of how hypnosis actually works, because when you rub this place, according to hypnotic understanding, you actually sort of activate the energy out of this spot to get less pain, which is the belief of Mesmer in the beginning concerning hypnosis. So what we identify as hypnosis at the moment in the field of dentistry is actually really a very large area of activities or large area of actions that we take, and not necessarily what a hypnotic session would look like in our minds as therapists. Now, of course, the very classical hypnosis practice in dentistry always relates to children treatment. And there is, of course, a justification to that. And the justification is very clear if you are aware of it. Children usually have a better ability to move into the subconscious state of mind compared to the adults. Now, what we do is we usually tell the children stories. I don't know if you were taught this at school. We usually say that when we want to inject anesthetic to a child, we usually introduce it into the theme of a story. So we say, now we change our voice intonation, of course, and we start saying, you have some bad germs at your tooth, and we want to get that tooth out and clean it, yeah, and get it back, and you have a new clean tooth. The way we do it, and there are lots of versions of stories, of course, but the way we do it is we get a bee, yeah, to come through the clinic, yeah, and just get that specific to sleep. Yeah, the bee comes and it zzz around the tooth, and then it gets that tooth to sleep. And then when the tooth sleep, we can get the bad part of the tooth, the bad germs out of the tooth, clean it, and then put the tooth back. We also use lots of different names for things. For example, we say about the clamp, which we use for if we are going to do a pulpotomy, for example, we say a ring instead of a clamp. So we say we'll put the cute little ring around your tooth, and then we put a big balloon, which is the rubber dam, on your mouth, so that we can clean the tooth better. And you know, we like balloons. Balloons are a good sign for a child. They link to birthdays, etc. Now, what I just gave you is an example of how hypnosis is done with a child, but on a very easy level. The reason why children are so is because children still have good imagination. And imagination helps them move freely between the conscious state and the subconscious state. And this movement allows them to disattach a bit or detach from the aware moment into a more imaginary area where they can think of other things and be distracted of the pain or the procedure itself, which is the core of hypnodontics. Now, going through the sequence, one might think, okay, now I know that hypnosis as a concept is about easing the mind out of focusing into the pain or focusing into the procedure, into something else, into an imaginary spot where the mind can be distracted, allowing the subconscious to take control, the subconscious which thinks about good things, which have stronger imagination, which is more related into the dreamy state of mind and less related to the aware present state of mind. And through doing this, we ease the procedure that we're doing, or we ease the post-operative outcomes of the procedure we're doing for the patient. And this gets us to ask a question, which is very relevant in this context. If we are talking hypnodontics and hypnosis, we always link that to easing the pain. We always link that to making the fear less. We always link that to making dental procedures less annoying and less fearful. And this gets us to think, what is actually pain? As adults, what do we think or identify as pain? And what is fear? And of course, what is anxiety? And these are three different things, of course, but they still all fall into the category of what we call experience-based emotions. And it's actually very interesting when we go into behavior psychology, you find that the mind has a way of identifying emotions based on a very innate platform. And this platform identifies pain, fear, and anxiety as all together as negative emotions that are experience-based. Back to the example of Mariam, my daughter, I told you that when she wants to sleep, she starts feeling pain in her head, she starts feeling pain in the eye, she starts rubbing the eyes, she starts feeling dizzy. But the only expression she has for all of this is to cry. She cannot differentiate between pain, anxiety, fear, the need for a mother, the need for food. She cannot differentiate between all of these. She only expresses all of these as a negative emotion, which requires her to cry. And she doesn't know for sure if what makes things better is sleeping or not. But usually when you introduce her into that soothing state could be by holding her, hugging her, especially the mom, singing a bit to her, she calms down. And this calming down is the hypnosis bringing the subconscious into the foreground instead of the background. So it brings what is actually needed into the foreground. And again, to identify how this links to what we are discussing, if you talk with any patient, any new patient, and you ask, if this is your first time to a dentist, how do you feel about it? Usually the response will be, I don't like it. I hate dentists. I would not feel that this is not the best part of my day. I remember one of my patients, I asked him, he has very good hygiene. He's always keeping good care of his teeth. And I asked him, you don't have any problems, you have never had pain, things are fine so far, but how is coming to me, how does it feel to you? How is this experience? And he had a very spontaneous response. He said, not the best part of my day. And I started probing a bit. So I said, but why is it not the best part of your day? And he said, it's actually a group of things. So even if my experience does not say it's a bad experience or a bad encounter, still, from the society, I hear that dentistry is painful. From the media, I see that people going to dentists always suffering. There's always this associated story of swelling or eyes being closed because of pain, or this image into the media of marketing for a medication that supports dental pain with a person pressing on his eyes, pressing on his teeth. So there is always this story around dentistry that is painful, that dentistry is an annoying experience. Now, why I'm telling you all of this is because this is exactly where hypnosis works. So hypnosis focuses on the experiences that you have and sort of distract you, or in a more advanced hypnotic model, changes your experience into making it a less annoying experience. Now, give you a concrete example. If we say, yes.
Sorry to interrupt. I was just gonna make sure that we're not seeing your slides. It's like, should we see your slides right now, or?
Yes, you should be seeing the slides.
Because we're not seeing it. If you share your screen with us, that would be good, because I thought you just want to talk without the slides.
Okay. Now, how is it now?
Perfect.
Okay. So you did not see the previous slides, did you?
No.
Okay. I started with this. This is Dr. Mesmer, the one who introduced mesmerism. And then I just went through this, the agenda for today, history, what we identify as hypnosis, the uses of hypnosis in literature, and then why did it disappear, and then the how. And then I got you to identify hypnosis in some of the activities we said. So soothing Mariam to sleep, suggestion, and then rubbing the hand. And then I was just discussing what is pain. Now you're seeing the slides, right?
Yes.
Okay. So to get back to the subject, as a conclusion, what I wanted to say in this regard is hypnosis actually works on how you perceive the experience. It works on what you feel about the experience. It's not actually working on the actual pain. So the receptors of touch will still be there. The receptors of pressure will still be there. The receptors of pain, the nociceptors, will still work. But your perception of all of this is altered as a patient. And this is a very important understanding I wanted to start with when we discuss hypnodontics, because lots of people think that hypnodontics is about getting people to do things they don't want to do. It is about getting the patient to sleep into a state in which you can stab the patient without him feeling. This is actually a very well-known misconception of hypnodontics, and that's how it links to the hypnodontics, the beauty, the myth. This is the myth about hypnodontics. Hypnodontics, or hypnosis in general, is not about removing the awareness of the patient. Rather, it's about changing the perception of this specific experience into something less annoying, less painful, less fearful, less unpleasant, in summary. Now, to go into a practical aspect, I guess we are running out of time. To go into practical aspects, let me discuss with you some of the uses of hypnosis in dentistry. And there are always the very famous uses, but then there are the less famous uses, which I want to discuss. This is a paper by Freshia, 1981, and it's a very well thought paper, and he includes lots of the aspects of literature where hypnodontics have been utilized in dental practice for two different categories. So first, therapeutic uses of hypnosis, and then second, operative uses of hypnosis. And usually we focus on operative uses of hypnosis, and that's why I'm mentioning this here. So some of the therapeutic uses of hypnosis is to actually change the experience of fear, to change the tensions, the anxieties in the mind of this patient. So one of the uses of hypnosis is actually not related to a specific procedure. No, you just bring the patient in, then you introduce him into hypnodontics, and you use a hypnotic session to ease this patient's general fear or tension of dentistry. You treat a previous trauma of dentistry. You deal with a very annoying experience related to dentistry. And this is one of the majorly important uses of hypnosis in dentistry. Now, a second thing is you get the patient to be adapted or used or accepting a specific orthodontic or prosthetic appliance. And this is one of the needs that we always face in dentistry, and we never think of hypnosis as a treatment modality or an alternative. And actually, it's one of the areas receiving attention recently after we have realized that there are some appliances or procedures that we need to do that need to have proper compliance by the patient to have good outcomes. And this area of use of hypnosis is one that is very advanced, requiring most of the time the presence of a specialized hypnotist to be able to hypnotize the patient into accepting this appliance. We see this with children in the mixed dentition requiring specific removable appliances, orthodontic removable appliances, without which they would have to go into more complicated treatment options, and still they are not used or accepting these appliances. So this area is very critical in hypnosis, and I will talk to you about how can this be used in such a treatment option through hypnosis. The third and usually also missed area of use, therapeutic use for hypnosis, is how do we modify dental habits? And this comes into discussion with pedodontists most of the time, in which they usually focus on using a specific appliance or a reminder for the patient to stop doing a specific habit, like thumb sucking or tongue thrusting, etc. But then again comes the area of how hypnosis could be an aid to modify this specific habit. So we bring the patient in, we get him into a hypnotized state, we sometimes talk to him to know what is happening, why is he doing that habit. That's part of a comprehensive hypnosis session. And then we even use that to alter the way he perceives this habit and to alter the way he behaves in concern to that habit to get that patient to stop the habit. And this is one of the very good, very successful therapeutic uses of hypnosis, and I will discuss an example of that in a while. Now, the second category, which is the more used category, is the operative uses of hypnosis. The article's name is Misconceptions Concerning the Use of Hypnosis in Dentistry by Freshia, 1981. And he also states a very good order for the operative uses. So he says the most important, very famous, most adopted is first analgesia. So analgesia, or the ease of pain, or decreasing the operative pain of a procedure, is part of the most important uses of hypnosis. A second thing is amnesia. And this is actually very interesting because through a very short hypnotic session, you can get the patient to not accurately recall all of the annoying details of the procedure that you're doing. Actually, I've been doing this for a very long time with my patients. And if you come and ask any of my patients, what's your experience with root canal treatment, since this is one of the things I do a lot, or root canal or apical surgery, root end surgery, usually you would find the patients not remembering after a while, because I keep on strengthening and using hypnotic messages to induce this amnesia of the procedure with the patient. So actually, even if if this procedure is painful or annoying or long in duration, the patient would not remember lots of that after the procedure is done. A third operative use of hypnosis is treating or managing the gag reflex in patients, and we will go into this with details in one article that I will discuss in a while. A fourth use is to decrease salivation and bleeding during work, and this is established in the literature. We found about that as a coincidence. So during most of the hypnotic sessions, patients showed less salivation and less bleeding during work, and even less bleeding and hemorrhage and salivation post-operative after work. The reason why this happens, or why this is justified, is because when you introduce the patient into a hypnotic state, think of it as if getting that patient to relax or meditate or completely detach from the moment of the now. What would happen is when you introduce him to relax, this patient loses the fight or flight reaction the body does when we are into a procedure, and then he's just simply relaxed. And when you are relaxed, you don't salivate much, you don't bleed much, because there is no action happening, even if you are actually doing a procedure. So these two categories, the therapeutic uses of hypnosis and the operative uses of hypnosis, are the evidence-based, the literature-supported uses of hypnosis in dentistry. Now, going through our sequence, I told you that hypnosis still exists around us. Hypnosis deals with the fear, the pain, etc. And the uses of hypnosis are, as we discussed, therapeutic and operative. But then comes the question, why, if it showed by 1833, why now don't we have hypnosis as part of the formal teaching of students? Why did it disappear in the education of dentistry, or why did it disappear as a practice by elder dentists? And actually, Sarah Nettleton, in her book, Power, Pain, and Dentistry, discusses this in a very specific way. And she mentions that it's partly due to one thing. That thing is, dentistry is characterized by being an era-based science. This means then that if you think about it, just a couple of days ago, or a couple of weeks ago, a video of a New Yorker procedure describing the root canal therapy spread on Facebook. White and black video of a dentist doing root canal therapy in New York. Also around, I cannot remember the exact date, but it was in the early 20th century. That dentist used a rubber dam or something similar to a rubber dam. He used something similar to a clamp. and used something similar to rotary files on a handpiece to clean the canal, then something like an obturation material to fill the canals. And now one might think, but how come this was as early as the 20th century, already established, even filmed, and yet during the middle of the century, we got people to come up with ideas as root canal treatment is not a biological treatment, root canal requiring teeth should be extracted, and even ideas as absurd as doing root canal treatment is not related to using a rubber dam or isolation, or you don't have to clean the canals, we can just go in, remove the pulp tissue, and then put some obturation material, or some other thoughts like that. Or, for example, the era that we are in now, which is the era of revascularization, regeneration, etc. So what actually happens with dentistry is that there are different eras of how dentists do things. And this is typically what happened with hypnodontics, is that as early as mesmerism was used in numbing patients, there was no good account of using anesthetics back then. What happened with time is that anesthetics became more widely used, more established, lots of variety. So to make things shorter, because going into a hypnotic or a mesmeric phase for a patient would take you 15, 20 minutes, to make things shorter and easier, dentists started using anesthetics. Chemicals, I mean, to induce anesthesia and to get patients numb. With time, people started forgetting other uses of hypnosis, and hence started not teaching those. This is partly the reason why it did disappear, because there is no very clear need for the use of hypnosis in dentistry. This is why it disappeared, because when it first appeared, it appeared relating to the ease of pain or doing a procedure in a painless manner. But then the other uses starting easily fading out. Now, another reason why it did disappear is because of something that happened during the middle of the 20th century, which is the banning by some schools of teaching hypnosis as part of a religious or spiritual activity relating to medicine. And this is a sequence that we saw across all areas of medicine. So spirituality and all of the teaching of the spirit and the movement of the energy was seen as inferior in science during the middle of the 20th and the beginning of the 21st century, getting people to sort of be distanced of that in teaching and in use. And this is why Sarah justifies hypnosis and hypnodontics became less and less adopted by dentists and less adopted by teaching individuals in universities. Now, the most, I would say, anticipated part, the most interesting part of hypnodontics as a webinar is to simply know an example of how do we do hypnosis, how can we use it to get a patient less in pain, or to get a patient in more ease in a procedure. Cheyenne, are we still on?
Yes, we are. And I didn't want to interrupt you, but we are online on Facebook as well from 20 minutes ago.
Okay.
And received so many good comments, likes, and everything.
Very good. Very good. So people are with us now.
Yeah, everywhere on YouTube and on Facebook for a long time now. And I just wanted to remind you that 14 minutes has passed since our webinar time. Okay.
We are actually almost concluding. So
okay.
Now, to introduce you to the most applied part of this webinar, I would like to let you go through this sequence that we use to get a patient into a hypnotic state or a hypnotized state. Now, the sequence is usually as follows across all uses of hypnosis. So first we do what we call a pre-phase or a pre-hip talk. Sometimes this nomenclature is used. And this pre-phase usually is in the aware, conscious phase. We sit with the patient, we talk, we say that we are going to use a relaxing method to get you to go through the procedure without much pain. This method will try to get you into a more relaxed physical condition and at the same time more relaxed mental condition so that you would accept the treatment. Sometimes you can go through previous experiences in this pre-phase. So you ask the patient if you had any previous experiences, how were they, describe them to me, what did you feel, what did you hear, what was the most annoying thing? And I usually do this with all of my patients. I usually ask them and they start saying that one of the most annoying things are sometimes very ridiculous things for us as dentists, but sometimes the light from the microscope, or the noise from the handpiece, or the vibration from the handpiece, or the posture of the dental chair. So these are things which you have to, we say, acknowledge before you go into hypnosis. And this is called the pre-phase. The second step is to do the induction. And the induction is where all the science is now. So hypnosis is all about the induction. How can you get the patient to move from what we call beta phase of brainwaves, what we call a conscious awareness phase, into the alpha phase, where the patient is more relaxed, where the patient is more accepting to what you are saying, etc. And the very simple, there are two well-known ways. One of them is called, through the use of the rapid hand movement. The way you do this is, I will show you after we're done with the slides in a video. The other way is by telling the patient a story, detaching the patient from the here and now into a more relaxed area. And we do this very famously by telling the patient to focus into an image, a picture, or like the one in the background of this presentation. So you focus into the picture, you imagine the wings of the butterfly, the colors on the wings, how they look like, and then you start to get the patient to focus into specific music or any monotonous background, and you walk that patient down a story. So you tell him, now I want you to relax, close your eyes if you want, or let them focus at the image, the picture you're showing, and listen to my voice. You start speaking slower, you start getting the patient to focus and imagine a way in which he walks, going down steps. Each step you detach of the now and here, and you start moving into your imaginary, really nice place where there are trees and the beach and music. So you start to induce this relaxation at the patient. And then you start relaxing the body parts gradually. And this is the very critical part of that. So you get him to focus on the tips of the toes of the legs. You relax the muscles of the tips of the toes, and you go a bit up into the foot. So you relax your feet completely, and then to the calf muscles, and then to the thighs, and then your back. So you get him to feel the relaxation of the muscles of the back. Throughout this description, the patient starts to also regulate his breathing. And by regulating the breathing, getting the patient to relax the muscles, you get him induced into this hypnotic environment, into which some patients will go really easy, and some patients will have difficulty going into, but with time get better. They can move into the next phase, which is the suggestive phase. And this is the whole core of hypnosis. Suggestive phase is about suggesting specific ideas that make the procedure less annoying. So you suggest the patient to relax the muscles of the mouth. You suggest the patient to to start feeling numb into the area. You suggest the patient to feel that the tooth is not sensitive to touching. You suggest the patient to have all of the. We do that specifically, as I'm saying, to have less bleeding into the place, to have the blood circulation all going into the core of the body. This is the area where you get the maximum benefit of hypnosis. And then finally, the getting out of the hypnotized state. And this is usually done in reverse. So we say, I need you to start feeling the tips of your toes, start moving them, start going up the steps of the stairs where you were. I want you to start feeling your back, the muscles of your extremities, your hands, your legs. I want you to start after the count of 5, for example, 1, 2, 3, 4, 5, opening your eyes, looking around. And then this is the way you get him out of the hypnotized state. Now, this is a simple hypnotic episode that you can do immediately on a colleague, a friend, or a relative to try the effect of doing that on another human being. Of course, I would recommend that you watch a video or attend a session with a specialized hypnosis instructor to know how this could be exactly done. But this is an example, a very easy procedure that can be done to ease a lot of the aspects, the annoying aspects of dentistry. Now, this is a case report. I'm mentioning a case report to tell you that hypnodontics is starting to come back to life again all across the world. This is work of Ramazani and his group. Some of them from Iran and partly from the USA, and they have done good management of severe gag reflex for a root canal therapy. I want you to check this paper. It's very interesting. It's a 2015 or 16 publication date. And it goes through a patient, 34 years old male patient who had severe gag reflex as measured on an index and a proper scale. And this patient had always the problem of not being able to do any dental procedure because of gag reflex. The way they did it here is exactly as we said. The first session was what we call the hypno-talk or the pre-talk. And they did assure the patient about any previous memories. They did what we call a mental remodeling. They describe a better dental experience with the patient under a hypnotic trance or under a hypnotized state. This was the first session. No treatment is done. You just control all of the experience, the previous experience of that patient. So you talk about what he had suffered before. He had obviously the gag reflex problem. And then you start discussing how can this be different in a way so that the patient is not is imagining a new experience in which this does not exist. And this is the first session. The second session is actually where the work was done. And in here, they used something that we call, as hypnotists, a conditional key. So the first induction is usually the most difficult induction. So the first time you put a patient into hypnosis is the most difficult time because patients don't understand what will happen. They don't know what to expect. But once they are into the hypnotic state, what we usually do is we link them with something. So it can be the press of a finger, patient finger. And this link is what we use next time as a conditional key to get the patient into trance or to get the patient into the state of hypnosis in a quicker way. In here, what they did is they used this conditional key to get the patient into the hypnotic state. And then they used what we call desensitization technique, which is they started introducing the instruments and devices like the syringe, the mirror, the explorer, the digital sensor into the mouth to get the patient to be desensitized of the gag. So after they got him to imagine this happening, they started introducing those into the mouth gradually. And desensitization means to get that patient used to this procedure. Under the hypnotic trance, these instruments are introduced gradually to get the patient to be used to this, or to accept the possibility of having such an experience. And this is the second session, in which all of the action is happening, all of the application of the hypnosis is happening. Afterwards, in the second session, the dentist did the access opening, the anesthesia, access opening, isolation, canal negotiation and instrumentation, and they did dressing. The third session, in a week, patient attended the office with no pain, and they got him again into the hypnotic trance without gagging, did the irrigation, canals were dried and obturated. Now, the very interesting thing about this piece of research is that they applied all aspects or all uses of the operative all the operative uses of hypnosis. So what they actually did is, during the procedure, they started suggesting things. So the tooth will be less painful after we're done. You will not remember a lot of this amnesia after we're done. Of course, the gagging was the main focus, but again, there won't be much pain post-operative. Yeah. So they used all of the potential of hypnosis on a patient in a practical manner to show how hypnodontics can be realistic and relevant in our daily practice. And this way, they finished the whole treatment and were done with the procedure. Now, to summarize what we discussed today, put into mind those 5 things about hypnosis to learn. 1, induction. Try to read as much as possible about alternatives of induction. How can we do induction? What are different types of induction? Ways that facilitate that, including visual tools like what we used to see earlier when they swung something in front of the patient or showed them specific picture, etc. Second, how can we use conditional key to make moving into the trance easier? And this is out of experience. This is one of the things you need to focus on, because it becomes really easier when you know how to get the patient into the trance quicker and easier without much effort into the induction. And third, to learn how to use everything around you to not be a distraction. To learn how to use the music in the background, to learn how to use the sequence of the instruments and the sequence of the procedure to get things to be not a distraction. So to learn how to make the environment a proper hypnosis environment, and this is a very critical thing. So always focus on visible and auditory absorption of the patient. Of course, remember the art of breathing. And the very simple way to focus on breathing is to teach the patient what we call evacuative breathing, which is to always inspire in a specific count, and then keep the air in for the same count, and then get it out for the double of the count. So if I inspire in 4 seconds, so I keep it in for another 4, and then I get it out in 8. If you try that, even now in front of your mobile phones, in front of your laptops, you will find how helpful this is to relaxing and getting the mind to focus better. And finally, and this is the area I told you about in the beginning of the webinar, conversational hypnosis or covert hypnosis, which are the different messages that we tell to the patients in a covert way through conversations in a suggestive language to get them to have better experiences with dentistry. So these are the 5 things I want to summarize, leaving you with. The 5 main ideas of where you should probe into hypnodontics, because now you know about the subject, you know that it's applicable, you know that there is literature about it, what I want you to do is to know what to look for to use hypnosis into your daily practice. And these are those 5 things. And with this, I guess we conclude. I wish it was interesting and I wish it was informative. The time frame is what's keeping me restrained, but there is a lot of ideas and thoughts to discuss about hypnosis and hypnodontics. I wish it was useful and beneficial, and I'm waiting for questions if there are any.
Thank you, Professor, for the amazing webinar. I'm just gonna ask the applicants now. If you have any questions, please comment under the Facebook post, or you can put it on the chat group of the YouTube post. So we will be waiting for some minutes for you to write your questions, okay? It was really interesting for me. I didn't know that this topic was also being worked on in my country. When you showed the Iranian research, I was like, wow.
You go and contact them.
Yeah, I should.
So any questions?
I'm just waiting for them. So we just received one comment from Abanov. Amazing, informative webinar.
Very well, thank you, Abanov.
And let's see if our Facebook has any more questions. Guys, please, if you have any questions, I'm repeating again, comment on the Facebook post, or you can write in the chat group of our YouTube page. So this is the last time I'm repeating, and please write your questions immediately so I can forward it to Hytham. Okay. Just more likes on Facebook and thank yous. Okay. Just more likes on Facebook and thank yous. Okay. Just more likes on Facebook and thank yous. Okay. More likes on Facebook and thank yous. Why am I hearing my voice 3 times?
You're being repeated all around.
Yeah.
This is part of the hypnosis experience.
Okay, so nothing on YouTube and nothing on Facebook, just likes and thank yous. No real questions. Did you provided your email address in your slides so that if anyone has any question, because
it's 9 o'clock.
We're gonna post this webinar on our YouTube and our Facebook. So if anyone wants to even watch it offline afterwards in the future, they can go and watch it. So if you can provide your email address for the future references, if they have any questions from you, they can email you. Okay?
Yeah, sure. I will share the screen at the moment now, so you can see the email address. Does it show now?
Yes. So it's hytham.abdelaziz@gmail.com. It's again hytham.abdelaziz@gmail.com. Listeners, if you have any questions, you can contact Hytham by this email contact. Once again, I thank you, Hytham, for your precious time that you put for us and this amazing subject, which will be really useful in the clinic and the future of dentistry, and also useful for all the dental students. I have to thank also all the listeners again for your attention and for attending this webinar. It was a pleasure to have you again in IDS Education. And we're going to continue next month in June, June 6th or 7th. We'll update you on our Facebook page. We're going to be live from Italy, from Zermac Company, and we're going to have a live workshop of impression with the Zermac staff itself. So stay tuned, and we will be back in less than a month again. International Association of Dental Students. I'm Sean, the scientific officer, and it was a pleasure to have you all. Thank you,
Thank you.
and have a good night, morning, or evening, wherever in the world you are. Bye bye.
Bye.